Hey guys, welcome to my lecture on controlling neuropathic pain. So I just want to go over this concept of diabetic neuropathy, and oftentimes we associate it with tingling numbness and the monofilament test, but also poor glycemic control. And when you've gotten to a point where glycemic control just isn't enough and there is semi-permanent or permanent nerve damage, you got to think about how you're going to control the neuropathic pain. So I'm going to go over the mechanisms by which we do control the pain. And I'm going to start off, so there's locally and centrally. So methods that are absolutely local. There are two ways which you would do that. One would be decreasing the depolarization of neurons in that local area in the peripheral nervous system. And the second way is through decreasing the membrane potential of fibers called nociceptive fibers. So remember that the nociceptive fibers are the ones that send signals about pain to the spinal cord and brain. So you're acting to decrease the membrane potential of these fibers, nociceptive fibers. Centrally, you also, again, you want to decrease the depolarization of neurons, but in the CNS. You also can act by decreasing the uptake or reuptake of serotonin. And a third method, which is not exclusively central, but mostly central, is acting on the opioid receptors. So agonism of opioid receptors. So locally, there are two drugs that are commonly used, and that is capsaicin and lidocaine. So capsaicin acts on the nociceptive fibers, and lidocaine acts to decrease the depolarization of the PNS neurons. And they're both actually topical agents. So that's pretty fitting because they act locally. In terms of central, we've got opioids or opioid agonists. You've got anticonvulsants. And you have your tricyclics. And of course, these decrease the reuptake of serotonin. These decrease the depolarization of the CNS neurons, and these act on opioid receptors. One way that I remember the different drugs is locate. So this is lidocaine, opioids, capsaicin, anticonvulsants, and tricyclics. And you've reached the end of my video.